I got it.
So basically what we're doing is we're just passively stretching, and then I can palpate here at the lateral epicondyles, at lateral epicondyle, and then I'm just basically going to stretch it to resistance right there. So we're looking for what? Pain, tenderness, reproduction of symptoms in this area here, right? You guys see that over there? Okay. So then next is extensor digitorum tubericus, and those are by the name, they're going to extend the fingers. So I'm going to press down. I want you to resist. Okay. So could I do the different other fingers? Sure, why not? So we're looking for pain into here, because again, if in any kind of test, if you expect this to be positive, then you might try a different finger. You might try, okay, let's go ahead and relax. Let's try it with his wrist flexed more like this, so we're stretching it a little bit farther. So let's try it here. So, like I was saying, here's the neutral position like that, so we can just do it like that. Then, if you want to modify the test a little bit, let's try it in this position. So resist, I'm going to press down, you press up. Like I say, you can try the test differently. Okay?
Do you afford the wrist or just
I think usually in the picture stuff, you don't. You never do it all the other. Does it kind of matter that much? You can try it different ways. Because you'll see there's a lot of slight little variations in the test, and when you're doing it in practice, just as long as you keep in mind that you know in your head what the anatomy is, what you're trying to do. Because basically we're trying to apply selective tension to tissue. That's what we're doing in all these special tests. So as long as you know in your mind, you think of, okay, here's the history, this is what I think is the problem. If there's no special test for what you want to do, make one up. Because as long as you understand the concept, right? I mean, I'm not trying to make light of all this stuff. It's just that it's not important for you to know, so and so made this test. When the angels came down from heaven and he was enlightened and all this. It's like you understand. Okay, here's what happened to the patient. I got to figure out what's wrong so I can figure out how to treat it. Do I think they stretched the dorsal ligaments? Was it an acute traumatic injury? Or did they pull some kind of muscle? So let's do some kind of a test that's going to apply selective tension to the tissue where the pathology is, and then that's how you do the diagnosis. Okay, so then golfer's elbow. So what are we looking at for that? Yeah, so we're going to test, I think you could do it in elbow extension. That's going to stretch the muscle a little bit more. So make a fist, press up this way, and then I'm going to resist back like this. Okay, so this is an active resisted test. I'm trying to look for pain or symptoms on this area here. So now we could do another test where here I'm just passively stretching the tissues. Okay, there's no that test isn't in the book, so whatever. It's the same concept. Now we're just passively stretching it at the end of the range, and we're looking for pain in that area. Because sometimes when you're doing, let's say if you're doing soft tissue mobilization or manipulation and you're working on it, you're massaging the tissues, and then there's different things like we talked about, like active release technique, where you're moving the muscle and you're manipulating the soft tissue while the muscle's moving. So, the same position that you're testing the muscle, you can also be working it and doing manipulation on it. Okay. All right, so then now we get into the nerve things. So what are we going to do for nerves? Either we're going to tap on them, we're going to stretch them, or we're going to narrow the space that they go through. So we've got what nerve is this here? What area do we call this? Good tunnel. All right, so what are we going to do? We're going to tap on this here. So is it normal for someone to get tingling into that when you do that? Yeah, but you're looking for, if the patient says, I have this problem where I have tingling here, and when you do that, you say, does that reproduce the same symptoms that you have when you have the problem? So then that's zeroing in on it, okay? So if we tapped on the nerve, then what's the other thing that we can do to test the nerve?
Stretch it.
We're going to stretch it. So how are we going to stretch it?
Seated elbow fusion.
Okay, so then you just have the patient sit with elbows flexed like this, and then how long is it there for? 3 to 5 minutes. Okay. So first when they're doing this, you're going to say, okay, now I want you to do this. Now you do this. That's a different test. Okay, so then now pronator syndrome test. So now what we're doing is so either with nerves we either tap on them, we do something that's going to stretch it, or we try to affect the opening that it goes through. So in this case, it's going through the muscle. So what we're going to do is the pronator teres is okay, start inflection. So this is, pronation is down like that. I'm going to resist pronation, so I'm going to try to pull this way. I want you to try to turn your hand this way, and at the same time I'm going to extend the elbow like that. So you're going to try to turn your thumb down, and then I'm going to extend it like that. Okay, so we're asking you, does that change your symptoms? If they're already, I don't want to say, did that make your hand hurt or tingle, because it might have already been doing that. So did that change or change your symptoms? Do you feel any difference when they do that? And you're looking for either numbness, pain, tingling here, or going down into here. Okay, so either you tap on the nerve, or you stretch it, or you narrow the opening that it goes through. All right, so then we'll go ahead and practice those. And if anybody wants to practice their psycho